Welcome to the deep dive. So, you've shared some really interesting material focusing on understanding anxiety, and today we're going to zero in on panic disorder.
Right.
Our goal is to really unpack what defines it, using these excerpts from Hayohet Vitam Lai Hansi.pdf that you sent over.
hmm
But we also want to kind of explore how panic disorder connects with other anxiety experiences. People ask about things like specific phobias, generalized anxiety, and OCD, obsessive compulsive disorder, as they're covered here.
Yeah, that's crucial. It's so important to understand the nuances because, well, anxiety isn't just one monolithic thing, right?
Huh.
Being able to differentiate these can really help clarify what someone might be experiencing.
Absolutely. Okay, so let's dive right into panic disorder then. The source defines it by these recurring panic attacks. When we say panic attack, what exactly are we talking about based on this text?
Well, the text describes them as these intense surges, periods of really strong fear or discomfort that just come on abruptly, very suddenly, and reach their peak, like super quickly, within minutes.
Wow. Okay, so it's that rapid escalation that's key.
Exactly. That's suddenness and intensity.
And there's that illustration you mentioned, the Vong Tron Hung Leon, the panic attack cycle. Looking at that, what jumps out at you as like a really core part of that cycle for understanding panic?
What's really interesting there, I think, is how it often starts. It can be a relatively small trigger, maybe an internal thought or just a slight physical feeling.
Right.
But that trigger gets interpreted as a threat, even if it's not actually dangerous. And that interpretation, that's what kicks off the whole cascade of anxiety.
So the meaning we give it is the crucial step.
Precisely. Then that initial anxiety leads to, physical sensations. Maybe your heart speeds up, you feel a bit dizzy, that kind of thing.
Hmm.
But the critical point in this cycle is when those completely normal anxiety responses get misinterpreted catastrophically.
Catastrophically. Like how?
Well, like thinking a racing heart means you're having a heart attack, or feeling dizzy means you're definitely going to faint or lose control. This uh, really fearful interpretation just ramps up the anxiety even more.
Which then I guess spirals into that intense fear of the panic attack itself.
Yes, exactly. That intense fear feeds back into the physical sensations and those scary thoughts, pushing it all to the peak of the attack.
Yeah.
And unfortunately, it often doesn't just stop when the attack subsides. The whole experience can then create this lingering fear, a fear of having another attack.
Ah, and that worry about the next one, that must just keep the cycle spinning.
It really does. This anticipatory anxiety can be incredibly powerful, and it often leads to avoidance behaviors.
Like avoiding places.
Yeah, people might start avoiding places or situations where they've had an attack before, or just places where they fear they might have one, where escape might be difficult.
Right.
And this avoidance, while it feels like a safety measure, it actually reinforces the idea that those situations are dangerous and, well, it keeps the whole cycle going. It's kind of ironic, a safety strategy making things worse long term.
That makes total sense. It's like you're teaching yourself to be afraid. Now, the source lists out the symptoms too. Katra Cheng Kuamut Kun Halam. There's a whole list. Could you maybe highlight some of the main physical ones mentioned?
Sure. And the list really drives home how much the body gets involved. Key physical symptoms definitely include that racing heart or palpitations you mentioned, sweating, trembling, or shaking,
Mm-hmm.
shortness of breath, maybe feeling like you're suffocating, or even a choking sensation. It's basically the body's stress response going into overdrive and being misinterpreted.
That sounds absolutely terrifying to experience physically.
It really is. And there's more chest pain or discomfort, nausea or stomach problems, feeling dizzy, unsteady, lightheaded, sometimes even faint. People might also get chills or feel suddenly hot. And then there's paresthesias. That's the pins and needles, tingling, or numbness.
So a huge range of really intense bodily feelings. What about the psychological side? The fear element must be overwhelming.
Oh, absolutely. Alongside all that physical stuff, there are major psychological symptoms. Things like derealization, that weird feeling of unreality, like you're detached from your surroundings.
Yeah, like watching a movie.
Kind of. Or depersonalization, feeling detached from yourself, like you're outside your body observing. Very unsettling.
Definitely.
And then there's often this intense fear of losing control, or sometimes people describe it as feeling like they're going crazy.
Mm-hmm.
And very commonly, a fear of dying.
Yeah.
That combination is just incredibly distressing.
That combination really paints a picture of how debilitating it can be, just the mental energy needed to cope. And the source stresses, like you said, these attacks are sudden, intense, peak really fast.
Yes, that's a critical point. It's not usually a slow burn of anxiety building up. It's this sudden, overwhelming wave of fear and physical stuff hitting all at once.
Okay, so that gives us a much clearer picture of panic disorder itself. Now, you mentioned the material also touches on other related conditions. Let's talk about amansa trinbit, specific phobias. The text talks about a noisa hindai a persistent fear linked to specific things, the objects, tinhung situations, sakin events. How is this fundamentally different from panic disorder?
Well, the core difference really is the trigger. With a specific phobia, the intense fear is consistently, predictably tied to a specific external thing.
Like spiders or heights or flying.
Exactly. Spiders, enclosed spaces, flying, needles, the fear reliably shows up when that specific trigger is present or anticipated.
So the fear has a very clear, identifiable target.
Right. Now, someone with panic disorder might start fearing certain situations after having an attack there, but the initial panic attacks often seem to come out of the blue,
Yeah.
without that clear external trigger that defines a phobia.
Ah, okay.
The fear in panic disorder often becomes more focused on the attack symptoms themselves and the terrifying possibility of having another attack, rather than just one specific outside thing.
That makes sense. The source mentioning different types, animals, environment, blood injection injuries, situations, really highlights how varied phobic triggers are compared to the sometimes more internal or unclear trigger for that first panic attack.
Exactly. It underscores that focused nature of the fear in phobias.
That's a super helpful distinction.
Yeah.
Okay, now what about rololonlantoa, generalized anxiety disorder, or GD? The name itself, widespread anxiety, kind of suggests a different experience altogether.
It really does. GED is characterized more by excessive, persistent worry. And it's worry about a lot of different things, events, activities, potential problems, a more constant state of anxiety.
Not that sudden peak like a panic attack.
Right. It's generally not tied to specific triggers in the same way as phobias or panic attacks. The worry is more, well, generalized. It's diffuse, pervasive.
And the text lists symptoms like my fatigue, trung, difficulty concentrating, irritability, kalkam, muscle tension, kanka, and sleep problems, kongo. These sound much more chronic, kind of grinding you down over time compared to the acute intensity of panic.
That's a really good way to put it. While someone with GAD could have periods of intense anxiety that might even tip into a panic attack, the defining feature of GAD is that persistent, often lower level, but still distressing worry across many aspects of life. It's different in intensity and focus from panic disorder.
Got it. Okay, that clarifies GAD. So one more comparison. Rolet nam kung chow OCD. We see terms like angisumyap, intrusive thoughts, and hanvikung, compulsive behaviors. How does anxiety fit in here, and how is that different from panic disorder?
Well, anxiety is absolutely central to OCD, but it works a bit differently. The ungaznep, these intrusive, unwanted thoughts, images, or urges, often cause tremendous anxiety and distress.
Right.
And the handikongche, the repetitive behaviors like washing, checking, counting, or even mental rituals, those are performed specifically to try and reduce that anxiety or prevent some dreaded outcome linked to the obsession.
So the anxiety is really tied tightly to those specific obsessions and the urge to do the compulsions.
Exactly. There's this cycle. Obsession causes anxiety. Compulsion tries to relieve anxiety, but it only reinforces the cycle long term. While someone with OCD could have a panic attack, maybe triggered by a really intense obsession or the inability to perform a compulsion, the immediate trigger isn't typically that sudden, seemingly out-of-the-blue surge of fear like in panic disorder. The anxiety in OCD is more directly connected to the content of those obsessions and compulsions.
Okay. So it really seems like, yes, anxiety is the common denominator across panic disorders, specific phobias, GAD, and OCD. But how it shows up, what triggers it, the focus of the fear, that's what really distinguishes them, that's actually really helpful.
Understanding those differences is key.
Now, the source does briefly mention therapies, Kaklio Lucia Liman, and it specifically calls out Liafat Nent Vahambi, CBT, and Liafat Tipsuk, exposure therapy. How do these fit into treating these conditions we've been discussing?
Yeah, these are really foundational treatments for anxiety disorders. CBT, cognitive behavioral therapy, helps people identify and challenge those unhelpful thought patterns, like the catastrophic misinterpretations and panic disorder we talked about.
Right, challenging the "I'm having a heart attack" thought.
Exactly. And exposure therapy involves gradually, safely confronting the things someone fears and avoids, whether it's a phobic trigger like a spider, or situations avoided due to fear of panic, or even confronting obsessive thoughts without doing compulsions in OCD.
So you learn the feared outcome doesn't happen, or you can cope.
Precisely. You learn through experience that you can handle the anxiety, and the fear decreases over time. Both CBT and exposure therapy aim to break those cycles of fear, avoidance, and unhelpful thinking that maintain these disorders. They're very relevant across the board, though tailored to the specific condition.
So, despite the differences in how the anxiety looks on the surface, there are core therapeutic strategies that can help. That feels, well, hopeful.
Absolutely. Understanding the specific nature of the anxiety is really the crucial first step towards finding the right kind of help and effective management.
Well, this has been incredibly clarifying. This deep dive, using the material you shared, has really helped map out the landscape, the distinct features of panic disorder versus specific phobias, GAD, and OCD. It's so clear that even though anxiety is that common thread, the triggers, the focus, the physical versus psychological treating Tumley's symptoms, how persistent the fear Nusain Daidong is, whether it's tied to objects, fluctuations, tinhom, or events, it all varies quite a bit.
hmm
So, thinking about this interplay we've discussed, this mix of body and mind in panic and other anxiety conditions. Here's a final thought for you, our listener. If anxiety is something you experience, what might be just one small step you could consider taking, maybe starting today, to better understand your own personal responses to it? It could be something as simple as just noticing, what tends to happen before you feel anxious or how your body specifically reacts. Maybe just that observation could be a valuable start to gaining a bit more self-awareness around it.
That's a really insightful question to leave people with. Paying that kind of gentle attention to your own signals, both thoughts and physical sensations, really is a powerful first step in understanding and ultimately navigating your own unique experience with anxiety.